and temperature instability. Rectal temperature is 38.2 degrees centigrade. He received routine vitamin K erythromycin ointment at birth but developed grunting, respiration, and mottled skin over the past 6 hours. Maternal history includes GBS positive urine culture, Group B streptococcus positive urine culture at 36 weeks untreated. Okay, so obviously it is a Group B streptococcus neonatal sepsis due to Group B streptococcus. Simple. Okay, but when it is early onset or late onset, it happens in a 28-hour hold. It is 28. Our cutoff is 72 hours. Okay, so it is an early onset. Okay, next let's see what else it has written for us. Vital signs: heart rate, respiratory rate with grunting and nasal flaring, BP low, SpO2 low, room temperature. Air exam shows peripheral hypothermia, capillary fill 4 seconds, hypotonia, weak cry, bulging fontanelle, and scattered petegy on the trunk. Labs: WBC 4200, platelets 80,000, CRP 12, and everything. Blood culture shows Group B streptococcus. CSF shows 500. And everything is CXR reveals bilateral hazy opacities. Okay, so it is in this case what will be the treatment. For treatment we'll use, it is also meningitis, because we have done lumbar puncture is done as written, so it is meningitis as well. What is the treatment? Empirical IV ampicillin and gentamicin immediately will given. Perform under lumbar puncture and transition antibiotics based on the sensitivities. Intrapartum GBS prophylaxis could have prevented this. Okay, so now let's talk about neonatal sepsis in very short and very quick. So what we have: neonatal sepsis means infection in newborn. Okay, so this infection causes what? It causes obviously septicemia and organ specific things like in respiratory system we have pneumonia. Okay, for pneumonia what we have শ্বাসকষ্ট. Next we have meningitis. So for meningitis I will have fever, seizure, and other things I have as well, but mostly most important are these two. So now this infection, time of infection, we have two types of sepsis. One is early onset, one is late onset. The early onset is first 72 hours of life, and it is after that more than 72 hours. Okay, source of infection here is ma, and in late it is hospital, so it is hospital acquired infection. Okay, source of infection, ma, and hospital acquired infection. Now, what are the risk factors? So, obviously, the most in chorioamnitis infection in mother. So, infection in mother's genitalia, premature rupture of membrane, sorry, not premature, prolonged rupture of membrane. Then, if infection is there, then it will be foul smelling, genitalia, vagina. Okay. Prolonged labor, many things. Whereas the hospital acquired, it is mostly unclean hands, unclean hands of the handlers and doctors and nurses and everyone, caregivers. Low birth weight, so low immunity, and lack of breastfeeding. Okay, so what type of infection happens here? Often pneumonia happens. Okay, infection, mostly pneumonia, and here all types: pneumonia, meningitis, sepsis, everything happens. Okay, next, what organisms are responsible for this thing? So, common pathogen, for our country will be Klebsiella, most common. Then Acinetobacter and Streptococcus aureus. Acinetobacter or Streptococcus aureus. For the entire world, however, for them, group B Streptococcus, that is GBS, is most common. Next, Escherichia coli and Listeria. Okay, the most important symptom is there is no specific symptom, non-specific symptoms. Okay, now what is the aftermath? What is the management? For this, the management is, first is investigation. So I will do a blood culture. This is a gold standard. It is time consuming, so sepsis screening is done. In sepsis screening, what is seen is total leukocyte count less, going to be less in sepsis, less than what, less than 5k. Absolute neutrophil count will be less than 1.8k per millimeter cube. Okay, micro ESR more than, it will increase more than 15 per hour. CRP more than 1 mg per TL. Newest marker is high procalcitonin. Okay, the last investigation we can do is lumbar puncture, but it is an invasive procedure, so it is done at the end for only for symptomatic babies. Now what is the treatment, right? So empirical antibiotics while awaiting for culture reports is done. First, obviously, we will give supportive care. Supportive care. That means simply TABC, maintain. T for temperature. Warmth is maintained. Okay, oxygen is given, airway, breathing, circulation, all are given. Next is empiric therapy. Before getting the empirical antibiotics, before getting the culture reports. So I have three type of scenarios here. One is low resistance. Here what will given, that penicillin, and amikacin or gentamicin. So gentamicin or amikacin, anything. If I have high resistance, in that case I will give piperacin, tazobactam and amikacin, ciprofloxacin and amikacin, or piperacillin, tazobactam and amikacin. Previous year question. In case of suspected meningitis, I'll give amikacin, ampicillin, and third gen cephalosporin, that is cefotoxin. Now, duration of treatment. If I have culture negative, I will wait. If the culture gets positive for meningitis, treatment. If culture positive for meningitis, it will be 3 weeks. others 2 week, because less dangerous. And if the culture is negative, then no problem. It's negative, that means ছেড়ে দাও 1 সপ্তাহে, 1 week. That's it. That's the entire neonatal seizure, neonatal sepsis.